Who is Hildegard Peplau, and what is her role in nursing? Hildegard Peplau was focused on interpersonal nursing roles. Now, in nursing, what she said nursing meant was a human relationship between a sick person and a specially educated nurse to recognize and respond to their needs. So basically, someone especially educated to respond to a sick person and the relationship between those two people. She came up with the term Psychodynamic Nursing, and that basically means the nurse must be able to ID their own behavior, help others identify their felt difficulties, so whatever they feel like there's difficult with them, you must be able to help others identify what's troubling them, and you must be able to apply human relation principles and problems that arise. So basically be able to take care of the situations that come up with a sick individual. Hildegard Peplau had said that there are different developmental stages. First one is you must learn to count on others. This happens during infancy. So during infancy you learn to count on others, and you communicate with your caregiver to have your needs met. So let's say you're hungry, you need to communicate with your mom, and if she fills your needs of hunger and nourishment, then you have learned to count on her, and that's what that is. So that happens in infancy. The second developmental stage is basically learn to have delayed satisfaction, something that is missing in a lot of American culture. This happens in toddlerhood. So it's to please others by delayed self-gratification. And an example of this would be not pooping on yourself during dinner, in front of family. Basically, you would be self-gratifying to be able to release your bowels and poop, because your stomach will feel better. But you would please others, like you please your mom and dad, if you delayed pooping and waited until dinner was over, and your mom could take you to the restroom. So you please others by delayed self-gratification. This happens in toddlerhood. The next developmental stage by Peplau is identifying oneself. This happens in early childhood. And what this means is you learn to perceive the expectation of others and adjust roles and behaviors appropriately. Basically, you're learning to see what other people want, what they're expecting, what they expect of you, and to adjust yourself accordingly. So, if you're at a dinner table and you see there's a bunch of old people around, you want to be respectful. You don't want to be loud. And you can kind of tell that your parents want you to be respectful, and you change into a more, responsible person. But if it was a bunch of little brother's friends and they're all retarded and acting stupid and getting crazy, then you can act crazy too. So identifying oneself and in the world around you is early childhood. Now, the other one is developing skills in participation, which happens in late childhood. And what this means is you're learning the skill of compromise, competition, and cooperation with others. Then, once you learn this skill, you are able to establish a realistic view of the world and your place in it. So basically you're able to get along with people, you're able to compromise, you're also able to compete with others, and you're also able to help others. And you can actually see a realistic view of the world, what the world's really all about, and how you fit in there. So that's developing skills and participation, which is a developmental stage of Peplau and the interpersonal roles. Now, the roles, specific roles, there are 6 roles in her theory. First one is a resource role. You're providing insight and data to correctly assess the patient's problem or situation. Basically, you're helping the client with data and information which will help them figure out what's going on, what's the situation, what's wrong with them. You are their data resource. Another role is a counselor. You are listening to the patient's feelings and helping them solve problems that this particular client is facing. So you're listening and helping them solve, the problems as a counselor. Another role is a teacher. You're identifying the learning needs of the person, whether they're retarded or they understand something, or I'm sorry, not retarded, mentally delayed rather. And you can help them in improving their life situation, basically helping them improve their life, but you're not going to tell them that you're doing all the work for them. And you're teaching the patient or their family. So you're a teacher. You're teaching the patient and family. You're identifying learning needs, like how smart they are, how intelligent they are, and then you're helping them solve their life situation. The fourth role is a leader, and this is like not a leader in the sense I know. It's a leader meaning you're leading the conversation. You're directing the interaction to achieve the desired goal, designated goal. So you have a specific goal you're trying to reach, and you're being a leader because you're leading the client and your whole interaction with them toward the achievement of these goals that you have already set out as a leader. Another role is a technical expert. So a technical expert is not someone who knows how to fix a VCR or whatever. It is having the clinical skills to intervene in the best interest of the client. Meaning, in the leader, you're trying to get from one place to a certain level of goal. Well, technical expert is actually knowing all of this stuff that we've been going over that will aid you in going from one stage to another stage. So being able to go from one stage to another stage means you have the technical expertise to do so. And then the roles. Surrogate. This is pretty much being the substitute figure for another. So whereas maybe this person was lacking a caretaker when they were young, you now are their surrogate caretaker. You don't want to tell them you're their dad or their mom, although they might call you that, but you are taking the place. You are the surrogate mother or father without actually being called that. So these are the roles by Hildegard Peplau and interpersonal nursing roles.